everybody, and welcome back to another live. Today I've got two special guests. I thought I was just going to be talking with Charissa, but Nina is joining us, which I am very excited about. And we're talking about cooperative care today. This is something that both Charissa and Nina will be presenting on at our upcoming virtual puppy summit. So we're very excited to be able to kind of give you guys a preview on what it is and why it matters, because this is something that I think there isn't a ton of info on out there, and it can be hard for pet people when we go to the vet and our dogs don't do well and we think that's just the way it has to be, and that's certainly not the case for our dogs. So before we dive into this awesome topic, if you guys don't mind sharing a little bit about yourself and what other presentations you will be doing at Puppy Summit. We'll start with you, Nina.
I am doing a presentation on how to reward your dog, and that is Friday at 3. And then I'm on the panels in the evening on Friday and Sunday. And then I'm doing cooperative care with Charissa, and that is Saturday at noon.
Excellent. And Charissa, you haven't been on our Facebook Live yet, so do you mind introducing yourself and sharing a little bit about what you are doing in the dog world, and then talk to us about your presentations?
Yeah, my name is Charissa Carvell. I own Alpine Behavior and Training in Colorado. I do a lot with pet dogs, but I also currently have a dog in search and rescue. So dabbling with him and helping my local team here with search and rescue tasks. I will be presenting toy skills. So playing with your dog, playing cooperatively, meaning you and your dog should be having fun. And then utilizing play and toys in training obedience, training sports, training search and rescue, whatever it might be that you are working with. And then Nina and I will be discussing cooperative care, and we'll go into that definition and more about that here shortly. And then on Saturday, I'm on the adventure panel Saturday evening, which will be really fun because living in Colorado, adventure is every day for us.
Yeah, I love it. So, and there's so many, I'm really excited about your toy skills talk. And I know you and I talked about toy skills a couple days ago, and that was amazing. I think it's a little bit loaded when people will say, oh, well, my dog's not food motivated or my dog's not toy motivated. But as people will learn when they come to your presentation, there's so many ways we can change how dogs feel about toys. And there's so many mistakes we can make accidentally when playing with toys and trying to use toys as, training tools and reinforcers.
Yeah, totally. I think we discussed, the Spitz breeds of Huskies, and then I grew up with hound dogs. Nina currently has an Akita, all of these breeds where people will say, well, they can't play with toys. They don't like playing with toys, and how we can change that narrative a little bit.
Yeah, absolutely. And today we're going to be talking about cooperative care. So before we dive into this, let's kind of give people a definition. What does this mean when we say cooperative care?
Go ahead, Charissa. Do you have the definition in front of you?
Yeah, so cooperative care is teaching our animals to participate in their husbandry care. And husbandry just means anything that, keeps them happy and healthy, whether that's grooming or veterinary care. After your hike, making sure you do a quick rundown that there's no spikes in your dog's feet and pads. So all of that is cooperative care, essentially. There's lots of different ways we can go about teaching cooperative care and things that we can do. And Nina and I will discuss that, but from low stress handling to distractions, meaning the dog is maybe licking a licky pad while you're trimming their toenails, to actually teaching them associations between, the Dremel sound means come running to me instead of hide under the bed.
Yeah.
And then, of course, all of the skills that are just like, we could go talk about forever, different skills you can teach. If you can imagine it, someone has likely taught it, usually in a zoo setting. But grabbing a dowel so you can look at your dog's teeth or brush their teeth, doing a chin rest so that you can do I forget what it's called off the top of my head, do medication in their first layer of skin. There's so many different things that we could teach. So
yeah, I think it's so important. I used to be a veterinary technician, and so obviously from the medical side of that, we saw dogs and cats come in every single day that were absolutely terrified to be in that environment, that needed significant medication to be able to do basic things like dremeling nails, and I think that when you look at the quality of life of our animals, how many things are we doing that are causing them stress, and for something like grooming, something like nail care, bathing, that have to be parts of their normal routine, I think it's so important to be able to not only just help them go from fear to tolerating, but then to go one step further and say, how can you be part of this team? How can I make sure that you're really enjoying this? And can I give you maybe a little more choice in this?
Yeah, I think
absolutely.
choice and control is. Oh, go ahead, Nina.
Yeah, I was probably just going to say the same thing you're going to say. That choice and control, it's a huge benefit to any dog, and it's a big reinforcer for them.
Yeah, I think when a lot of pet people come to us and they're looking for training, it's so they can have a well-mannered dog, right? So they can have a dog that they can take out into the city and go walking. And I think sometimes not only do people not know that this type of training can happen, but maybe don't want to put in all the time that they think is necessary unless, there's a significant issue. So when you guys are working with clients and helping them with cooperative care, how do you get started with that? Are there certain things you focus on and put precedence on? And how do you kind of relay the importance of this type of training?
You want to go ahead, Charissa?
Sure. I think in my area, a lot of times it can be people will feel like it's too late. They're referred to me by their veterinarian, and it's because the dog may have already bitten the veterinarian or the technician. So there's a lot of proactive things that we can do with young dogs, with puppies, with animals before they feel like they need to get themselves into trouble that way. But there's also a lot of things that we can do if you're already seeing problematic behavior in the dog. And then there's a lot of things as a veterinary team too. I've talked to a lot of vet teams, the CSU veterinary school even, and just on that end, things that they can do to help animals feel comfortable coming into their facilities. So I think Nina has a lot of young dogs that she has the opportunity to proactively train. So she may be able to give you some of that. But I think the first thing that came to mind is the other end of the veterinary team being able to have a treat stash right away, how to greet the animal to make sure there's not so much discomfort. Can we keep our lobbies not so full so dogs aren't being put next to each other, which is going to cause excessive stress, that sort of thing.
And what about you, Nina?
Yeah. So I start with just like some of the basic stuff that gets people to see the return on investment. And that's things like, can you put the harness and the leash on quickly and efficiently? The dog enjoys it. They come put their head in. And so when I can teach that to a dog in like 90 seconds, they're like, oh, this isn't so time consuming. It's not so complicated. We can make it very complicated. Like if you're a behavior nerd, boy, we have some things for you. But if you just want the practical benefits of just being able to leash up your dog very quickly, being able to load them up, being able to walk them into the vet and have them get on the scale without major issues, then we have that too. And we can do it pretty quickly.
Yeah.
Like once we have some patterns and some reinforcement strategies established, we can build these kinds of behaviors fairly quickly for dogs who don't already have major issues.
I think that's huge too, that, you're talking about kind of the practical side of it, because yes, we can get fancy and we can teach a dog how to do a stand stay for a blood draw, or, all lay on their side for x-rays. But it also can go into our real life routine with them, in the sense of teaching them how to get their equipment on. You picking up a harness does not have to result in your dog taking off and running backwards. And all of these things, not only do they apply to our day-to-day life, but a lot of them will have kind of overlapping themes in them, in the sense that it's going to be building your relationship with your dog and using some cues, using some tricks that you can teach that will translate to other things, like hand targets and chin rests have a lot of practical applications to them. When you look,
even like cute pictures,
Yeah.
right? Who doesn't like cute pictures? So if you can get your dog to go to a certain place and be comfortable while you do things like pick up a camera, that is the other side of cooperative care, really. It's weird props and go here and do this and look happy.
And be happy, right? We want them to enjoy this. So as you're starting this, Nina, you talked about, some patterns, and you talked about some reinforcement. And I know we talked about that the other day, but are there certain patterns with reinforcement or pattern games that you like to incorporate when you're doing your cooperative care training?
That's one of the things that we're actually going to show you a pattern that I use to teach multiple things. And it's the same pattern for chin rest, for muzzle, for collar gives. It's the same pattern over and over again. But I think the number one skill is, can your dog eat? Because we do ideally want to take this on the road. And if our dog can't eat, then we have to start there. And that's something that we can teach for sure. But the pattern of eating and then staying checked in is the first one. So don't eat and then leave, but eat and say, oh, are we doing more? So we can build a bunch of stuff from that.
And are there certain behaviors that you like to work on for this that also have applications for real life? So we talked a little bit about the harness. Hand targets can be really useful. Learning how to relax on a bed can be really useful. Do you find certain behaviors that are generally seen in our pet homes becoming more handy when we're working with cooperative care?
Yes. Get on something and lie down, and that could be a mat or a bed. I like to use a specific one, like a specific towel at first, but can you get on, like if I put something down, can the dog get on it and lay on it, or can they get on it and just stand there comfortably? And then of course, chin targeting or nose targeting. Anywhere, we can use pretty much any part of the body, but the chin and the nose are some of the easiest to teach. And again, they have practical pet life applications. So we're not just putting time into a behavior that we're only going to use for husbandry.
Now, I know that you, both of you, run the cooperative care Facebook group, which has a bunch of people in it. And I think that one of the main questions that I see pop up on quite a regular basis has to do with medication administration. And this is something that for our dogs who might have lower interest in food, or have learned that medication comes hidden in things, that can be problematic for our dogs when we're trying to administer, because even healthy dogs that don't have chronic issues get medication. So Charissa, walk us through some of the things that you kind of go through when you're working with medication administration.
Yeah, there's a lot of different ways you can go about it. I'll walk you through one thing that I did with Fen. He came back with a long list of allergies. So we started him on oral drops that I'm sure didn't taste good. So my plan for it was, I liked the oral because I didn't have to give shots, which he already is getting Cytopoint shots for allergies anyways. So we went with oral. I taught him to jump up on something. We used a climb. If he was on the thing, then I would come in with the oral medication. At first, I kind of just put it in his cheek and squirted it in there, and I would follow it with cream cheese, which is his favorite thing. If at any point he got off of the climb, I would stop and we'd try again in an hour or two. And it worked. You know, he had to be on it for I think a year. So it was a year of like the heavy dosage, and then we tapered down. And by the end of it, he was sitting on a rug in front of the fridge, and he'd actually open his mouth. So he'd kind of like pop his lower jaw down. I'd squirt in, and then we'd do cream cheese. So that was kind of our procedure for a liquid, kind of gross medication that I knew I had built a bit of a plan ahead of time as far as jumping on the thing and what I was going to do if he at any point refused the drops.
So that's interesting, because when we're looking at some of our cooperative training, we might not realize that we have a problem until we have a problem, right? So a lot of the times, if our clients are going into the veterinary clinic, they need to get medication, they go to give their dog eardrops or whatever, and the dog's like, I don't want any part of this. And that can be hard, because as we know with training, it requires a little bit of planning up front. It requires that training plan, and we set it up so that the dog has choice along the way and is not stressed out, right? That each little piece of advancement in that puzzle only gets a little bit more challenging so that the dog can be successful each time. So how do you, in a situation like that, Charissa, how do you manage, I need to do this thing, it's got to happen, and maybe my dog isn't quite ready for it in our training plan?
Yeah, that's something that pops up a lot, and I'm pretty passionate about. So it depends on the dog. Of course, it's going to depend on what it is that we need to get done. But I would have some sort of plan that is consistent and is clear every single time. So I want to avoid trickery. I want to avoid, too much weirdness. Like, I don't want to be like, look over here, poke you in the butt. I want it to be pretty clear. So whatever the plan is, whether it's this dog is going to need a muzzle for the human safety, that could be part of it. So we put the muzzle on, we do the procedure. Or, for example, my previous dog, Emmy, we were working through a plan for nail trims. But in the meantime, if we had to do a nail trim so that she didn't hurt herself, our plan was my husband was going to hold her and I was going to go through and do all of her nails. It always looked the same. I would say, are you ready for a nail trim? I'd get the Dremel out. She'd see the Dremel. I would grab her by the collar nicely and just hold her still. He would come in and we would say 1, 2, 3, scoop. He'd scoop her up. I'd go do all the nails, and then she'd get put down. She'd get a snuffle mat, and then we'd usually play with a toy inside. So that was kind of it worked like that every single time. We never varied from it. She didn't like it. Like, no part of her was like, yay! But it was clear, and I think that avoided a lot of frustration between her and us. And then we were working on the Dremel outside of that and offering, breaking it down into teeny tiny steps, hearing the sound, feeling the back of the Dremel on her body, on her toes, on her nails, and really cutting those steps into smaller chunks.
I love that. Now, something that you mentioned I want to dive into a little bit more is this idea of tricking, because I think that sometimes when we think we're trying to make unpleasant things pleasant, we can bring out what we would call distractions to kind of help lessen the blow, so to speak, to try to make it better. But that order of the skill or the behavior and the food matters quite a bit. It matters when we bring the food out. It matters how we bring the food out, so that our dog doesn't become distrusting of us or start to look at food in a different manner. So Nina, do you want to kind of start that conversation? What does that look like when we trick our dogs, and why is that order so important?
So the order is setting the expectation, like it's setting the predictability. So if I bring out food and then do something weird or scary, then food becomes the predictor of weird and scary. And often there's other contextual clues for the dog as well. But that can influence your outside train, like the training you're doing outside, because they're going to have that question in the back of their mind. Oh, she's got treats. Are we doing that weird scary thing, or are we training? And so then we get those expectations that are violated, or their expectations that are set that we don't want set. So that again, I'm also very passionate about that. And dogs who are a little finicky anyways with food, like we have to work hard on eating behavior. Please don't trick them. I know it can work, but if you have a dog who's going to be on meds for a long time, if you're hiding that, you're really gambling, because it works until it doesn't work. And when it doesn't work, usually those dogs, particularly dogs who have kind of, mixed feelings about eating anyways, and then maybe mixed feelings about some of the stuff that we do, that really influences their eating behavior outside of cooperative care. One of the things that we will talk about is how there are times when using distractions is good. It's a good plan of action. And we'll discuss that in our talk as far as what that should look like and how do we make that calculation. Because if it's something that's happening once every 3 years, for a rabies shot, you can probably get away with it under certain conditions, particularly if the person administering it is skilled. But we want to look at certain variables and make that calculation.
And that training plan and that use of food, kind of the order of it can change as well, depending on the age of the dog. So, Nina, at the start, you were talking about how you work with more puppies and trying to build these behaviors up from the beginning. Whereas Carissa, you might see more of we've already had a bunch of negative associations. How do we now come back from that? And even that type of training, while our goal is the same, to get a dog who, enjoys this process, that training plan can look different based on age as well.
Yeah, and what the animal is going through. Like, I've seen a lot of female doodles, if they're in heat, they're just extra ouchy. So brushing them doesn't feel great. And that's something to take into consideration if you have a dog like that.
So let's talk a little bit more about grooming, because this is something that dogs of all sizes and ages have to experience to some extent, some a little bit more than others. When I was raising my last puppy, he's a conformation dog, so grooming and nail care was huge. And I really wanted to make sure that not only did he just tolerate it, but that he loved it. Right. So now I can pull out my grooming table and he'll literally body slam my other dog out of the way to get there faster, because he cannot wait to get on the grooming table and have these things done to him, because he's enjoyed it. So I think that obviously I have a grooming table and a big force dryer. A lot of people don't have that at home. So are there ways that we can help set our dogs up? Maybe if they're planning on bringing their dog to a groomer, some things they can still do at home for maintenance, grooming, and prep to help the dog get ready for the groomer.
Yeah, I think brushing is a big one, making sure that you have a good brush. I mean, talk to a groomer about what you should purchase for your pet. Having a brush that works well for your dog's coat hair, isn't going to hurt them, how to use it so you're not going too hard possibly. But I think that's a huge thing that people can be doing at home and practicing. And you could, apply all the fancy stuff of do a chin rest, brush you, feed you, do a chin rest. Or we could just do some happy associations that when you're getting brushed and the brush is out, the best things are out. And every time I swipe a brush over, you're going to get something good. And then, I'm going to get this mat out and then you're going to get something good. I think that's a huge thing. There's lots of tricks that you can do. One that I learned from Laura Monaco Torelli is cutting pasta. It sounds like a nail trim. So cutting that, feeding the dog. using an electric toothbrush as a Dremel feel on your dog's feet, even if you don't have a Dremel at home. Obviously a blow dryer, you could practice like, this is a fun thing, something that we can play around with, versus a scary thing, even if you don't have a force dryer at home. And I think a huge one is just like making the tub space or the shower space a fun place, not just the place that the scary, weird stuff happens, but like, when else do we do that with our dogs? When else do we like work on jumping in and out of the tub with our dogs other than to actually put the water and the shampoo on them? So just kind of playing around with that. Maybe we eat dinner in the shower today. I don't know.
Yeah. There's so many little things that we can do to help them become comfortable with that space. I had a client reach out to me the other day, and she wants to get her dog comfortable with bathing at home. And the dog has had so many negative associations with the tub that the dog won't eat while they're bathing, and the dog won't follow them, even with a hand target, into that bathroom space. So that area itself has become so unhappy for the dog, that the dog is unhappy there because these negative things have happened, and the dog has these negative associations. So I think that, even again, kind of going back to what Nina said, like, look at where the dog does take food, because in that circumstance, it's not that the dog is unfood motivated or that the dog doesn't know a hand target, right? Or that the treats aren't high enough value. It's that the dog is stressed out. So we have to go back to that place where the dog will take food, where the dog can respond to cues, and that's where we start working. So with this client, we're starting to play follow and hand target games in the hallway, and then trying to slowly work on getting the dog in and out to really kind of break that process down into those small pieces. Now, Nina, go ahead.
I was just going to add a little something, because it has to do with location. And I think this is something it's something that's easy to do, but gets overlooked. So oftentimes when we talk about cooperative care or handling, the response right away with people with puppies is, oh, he's fine. He lays in my lap and, lays on the couch and lets me touch him everywhere, which is a very different situation than when the dog is up in a new location and it's a more formal setting. And so doing like, you don't have to necessarily certainly go to the groomer and have a happy visit, but you can set things up so that it's not just in your couch or in your living room on your couch while your puppy is sleeping. You start where you can be successful, but it may mean going to the front lawn and putting a towel down. Can your dog eat there? Can they get on the towel? Can you brush them there? So it looks a little less like the sleepy comfort zone and a little more formal.
Yeah, that's huge. That's huge, because a lot of times our dogs are more comfortable in those quiet and relaxed environments. But when it starts to look a little different and we ask them, is this still okay? Sometimes the answer is no. So again, even having that information for us will help us shape our training plan. Carissa, were you going to add something in there?
Yeah, and along those same lines, if I'm doing a no choice procedure, so I'm not asking the dog if they're ready or if they need to stop, I will pick a space that is consistent, and I try to pick a space, if it's in my house, that they really enjoy. So if I have to do a thing that they don't like, I'll usually do it in my training room, which all other interactions in that room are good, so that I'm not poisoning the bathroom or poisoning the back bedroom or whatever it might be.
Yeah, that's a good point. That's a really good point. Trisha says, helps to change the association, such as if one bathroom has a negative association and you have another bathroom to use that space as well. And that's true. Again, dogs, Nina, you mentioned happy visits, and happy visits are great. I want you guys to touch on those for just a minute. But that's a really nice example of that, of a dog that, they know that bad things happen when they go into the vet, and things are a little trickier now with COVID, because a lot of veterinary offices are not allowing the dogs inside, or the people inside with the dogs for these types of visits, but in the hopes that our world will return with some semblance of normalcy. Nina, do you want to dive in a little bit more as to what happy visits are and how we can really make the most of our time while we're there?
So happy visits are just like they sound. It's a visit to a place like a vet, a groomer, even a training facility. I mean, it could be anything that we're working on, a rehab facility. where the dog just goes and the expectations are just eat, play, be relaxed. So we're not doing work. They're usually quick. It depends on the business, whether it's going to be a paid visit or not. But for many places like groomers or veterinarians, they're happy to have people come in because it makes their job easier, right? So even if you usually don't have to schedule an appointment, but again, pandemic and everything. So just call ahead and ask. But it's very low key and it's usually very quick. So it's not like a big part of your day. There are situations where you may be able to do a drop off and come back, but that's less common than just going in. The receptionist takes the leash, they give treats, and the dog leaves.
Yeah. And these are things too that once you're a little further along in your training plan, if you've been working on that go to mat behavior or that chin rest or your hand target, you can start to practice some of the skills you've been working on at home in that real world environment with your dog. And that can be really helpful in not only helping them generalize and learn that this behavior is fun no matter where we do it, but also to build those positive associations with that space.
Yeah, absolutely. Can you go in? Again, it's pandemic, but there's clients that I've taken into vets and I contact them ahead of time and we just do relax on a mat in the waiting room or in an empty room or, sometimes outside on the side of the building where we're just going there and nothing crazy is happening. I had another client where we would go and do some tracking on the side field. So she knew she was at the vet. She would go in, say hi, and then we'd go do some tracking because she really liked tracking. And she had big feelings about handling. So we were just forming that association so that she's not amping the minute she gets out of the car, right? She's saying, oh, there's like good stuff that happens here too.
Now, if somebody has not gotten started yet in their cooperative care training plan and they were going to be going into the vet office, what kind of tips would you give them in terms of things to look out for with their dog's body language, and then what kind of things would you have them bring to help the dog feel the most comfortable?
I really like bringing a snuffle mat so that I can keep my dog calm. He's using his nose. He's sniffing out good treats in the snuffle mat. I usually start with high value treats and then taper down to lower versus starting with low, the dog refusing it, and then coercively going higher in my treat value or value of reinforcement. I always, if it's safe, leave my dog in the car. I go into the lobby first and just check it out. Who's in here? Is there, a loose cat somewhere? And then maybe even talking through the procedure. I'm here for, a blood draw. What size is the needle? Where are you going to be poking? If someone is available to do that, can we talk through this really quick just so I'm prepared? Asking your vet team what their protocols are. Can I hold my own dog? Can I restrain my own dog or not? Who's going to be restraining my dog? Are you guys more comfortable? I have a German Shepherd. So are you more comfortable if he's in a muzzle? Even if he doesn't have a history of showing me concern, he's big and black, and a lot of veterinarians have had bad associations with different breeds. So can I make everyone more comfortable in some way? A loose fitting leash, a loose fitting harness in case we have to do anything underneath the harness. Can the vet reach in there and feel all the good stuff? Are kind of my go-tos. And then bringing him in, I try to just focus on my dog. Is the receptionist peeking over the desk, freak him out? Great, let's feed. Let's do a treat scatter or treats in our snuffle mat. Bringing a relaxation mat as well that they have had good associations with in the past, that jumping on that thing and laying down is going to get them rewarded. I'll bring that in. Just kind of preparing for anything that's going to happen. Who's going to pop through the door? Is it a tech? Is it a doctor? That's kind of my run through.
What about you, Nina?
Pretty much the same thing. Some of it depends on how the practice is set up. So having staff that you can communicate with and trust. So even if, like, it may be best if they take your dog to the back. Like, for some dogs in some situations, that may be the best thing. But it's really just about having that open communication, and being able to work together. But as far as like my props and stuff, I'm pretty much the same with Carissa. I'll bring a mat, food, maybe a snuffle mat. And then as my dogs get more and more experience, like today, I just went in with treats and that's it. And we got our vaccine. Like, we just got a couple vaccines, and I've got the Akita and the Malinois, and the Malinois has much more cooperative care training, and the Akita has much more just associations. So we did 2 fake pokes, a treat after each one, and then a real poke, and then treat, and then a fake poke. Whereas the Malinois did a chin rest to consent, and then we did the poke. And I have a cue that tells her you're gonna get poked. Do you want to get poked? Perfect. And she says yes, and we feed. So, like I said, it can be as complicated or as basic as you want. And then as you build that experience, you can pare down some of the stuff that you bring for some dogs.
I love what you both have mentioned about that open line of communication too. When I bring my dogs in, I kind of know what needs to be done in terms of procedures, because I used to work in that facility, and they know that, so they do less talking to me, but having that open line in terms of, this is where we are in our training plan. Can you do X, Y, and Z? Or, asking them. So for my boy Lennon, we've started doing his exams outside because he's much more comfortable outside than he is inside, and the vets are okay with that, and when he's got a little bit more space, and we do the same thing. I'm going to touch you here. You're good with it. Awesome. I'm going to poke you. Okay, now it's happening. But having those 2 test runs, before the real deal happens, can help reduce some of that surprise for the dog. Gives you the chance to kind of help communicate to them what's going to happen, and then the treats happen. Something else that has been helpful for me is, if you live in a multi-dog household, it might be more convenient to bring them all at once, but sometimes bringing all of them at once in the room together at the same time can be overwhelming, can also be distracting, can be more exciting. And so depending on what behaviors you've trained and how far along you are in that process, it might be easier for the dog to leave, some of them in the car, if that's safe temperature wise, or even at home, so that you can really focus on that dog in front of you and their needs, instead of letting that environment kind of move from relaxing into more exciting.
Yeah. And for the handler too. I mean, I never handle 2 dogs at once at the vet.
Yeah.
I just don't do it. It's too stressful for me. So I will leave one in the car. I've got a vehicle set up for dogs. Or I'll make separate appointments. And that's, even if the dogs would be fine, I would just be irritated handling a bunch of dogs. So that's not a good place to be.
Yeah. Now, in terms of some manners or behaviors that we can teach to our dogs, we've talked already a little bit about, a hand target, how that can be easy to move the dogs around. We've talked about settle on a mat, or teaching a dog to relax or get up onto an object. Are there other basic skills that you find that are extremely helpful for your husbandry training that are also applicable to like our real life, things that are good crossovers there?
I really like just sit at my side while I talk to someone. So, I'm checking out and I don't have time to put you back in the car. Can you just sit at my side while I pay? That transfers really nicely to going to breweries, to talking to neighbors out on walks, things like that. Can you just hang there, wait for food to come to your face and relax for a second?
Yeah, that is super. And your hands are busy when you're checking out at a cash register or something like that. One thing that's come up quite a few times in our chat today is this idea of choice with our dogs having the ability to say no. And I think that for a lot of people, this can be a challenging concept, because if it's something medical that just needs to get done, or something that they think the dog should be able to do, sometimes people will put a little bit of pressure on their dogs and not give their dogs that choice. But can we quickly talk a little bit about what choice is, what it looks like, and why it's so important. Nina, you want to start us off on this one?
Yeah, I think clarifying that if there's a medical necessity or something has to get done, we absolutely do it.
Yeah.
We don't ask though. So that's, I think, the big aha moment for people is if I know if my dog has an ear infection and I need to get meds in, if I have to do it or I know it's going to be painful, I don't ask my dog to participate in something painful. So in order to consent or to opt in, the dog does have to more or less know what's going to happen. And so I don't ask a dog to opt into something that's going to be painful because I don't have a way to communicate that to them for the most part. So a little stick is one thing because I can kind of approximate that, but putting ear meds in when the ears are inflamed, that's something else. So if it's a medical emergency or it's something like the dog has to take the meds today, then we don't ask, can you do this? I say, I'm going to do this and I'm going to be as efficient as possible and make this make this go as quick and be as, the least unpleasant as I can. And sometimes that may mean for pet owners having a professional do it, like having your vet do it or having a tech do it, because they can do it so efficiently and they don't have as big of feelings about it. While they care about your dog, they're not worried about what they're doing and worried about the dog. They can just get that medication in and then it's done and we're on. So I think that's where I get the most buy-in when I explain you can absolutely still, give your dog the necessary medical treatments, but at the same time, we can work on the dog choosing to participate in things that don't need to happen right now or that aren't going to be really unpleasant.
Yeah, that is huge because obviously if it's something that has to be done for medical purposes, we certainly don't want to withhold medical care for our dog. But our choice or asking our dogs, rather giving our dogs choice in our training plans can look quite different than that. Carissa, talk to us a little bit about that front.
Yeah, I think there's a lot of places that on a daily basis we can give our dogs more choice, whether that's which harness do you want to wear today? Which bone do you want? Which food dish do you want to eat out of today if you have multiple puzzle toys? Which crate do you want to go into? Is this one better than this one? And that can look as simple as I hold out two things and whichever one you grab first, that's the one you get and the other one goes away. In cooperative care, it could look like there's two different brushes. Which one do you want? As well as it could look like a trained behavior or just a behavior that your dog offers. Fen offers sitting quite a bit. So I've transferred that to a lot of things. So if I hold the brush out and you sit, I'm going to assume you're ready and we're going to start brushing. And that pretty quickly, he's going to pick up on that. And if he stands out of that sit, I stop brushing. Great, I'm ready again. I put my butt back down, I brush. It could also be a trained behavior. So can you put your chin in my hand? I've taught you this. Great, that starts my behavior to do something that maybe you're prepared for, obviously, like you've seen the nail clippers or whatever, but you may not love that, the day before. So can I touch the nail clippers to your feet? If your head pops out of my hand, I stop doing the nail trim. A lot of times I ask in a way of tossing the treat away. So if you're in a station behavior, if you're on something, I want to ask if you're really ready to keep going. So I'll toss the treat off. If you come back on, great, we'll keep going with this nail trim. If you come back, but you don't really get back on, maybe it's 2 feet or you circle it a couple times or you eat that treat and you leave the room, then we're done. No more nail trims for today. And I, as the trainer, the owner, have to just say, all right, no big deal. We'll get the rest of them another day. I think where it gets dicey is when the dog says, okay, you told me I can leave, so I'm going to leave. And then we say, but people are coming over tomorrow, so I really have to get this nail trim done. Come back in here and sit on this thing.
Yeah.
That's where it gets a little dicey, and that's where, we can lose some trust.
Yeah, and that's so important. A lot of people have a challenge with our own thoughts about that, not finishing all the nails at once or not completely grooming the dog at once. And I think that that's a big hurdle that we as people need to change our minds on, because if we want to keep building this good relationship, if we want our dogs to trust us, if we want our dogs to enjoy the process, their ability to say, oh, I think I might be done for today, has to be respected. We need to make sure that we're allowing that process to happen and going, okay, not a big deal, we'll try again later. Now, something that you mentioned, Charissa, that I'd like you to dive into just a little bit more is that idea of the dog either being cued for a behavior or the dog offering a behavior, and that being our signal as a human that we get to go do the thing. Can you talk to us? I know this is probably something you're diving into quite a bit during your presentation, but can you talk to us just a little bit about maybe the decision between putting a behavior on cue versus going for something that the dog offers, and kind of why this behavior is important, why that gives us more information about maybe how the dog is feeling about cooperative care?
Yeah, so it could boil down to this behavior I need to teach because it's going to be easier to do the procedure. For example, me giving at home Cytopoint, which is an injection in the back of his scruff under the first layer of skin, it's easier for me if his head is facing away from me. And I can have two free hands. So he'll do a chin rest either in my husband's hand or on a platform of some kind. That way his head is straight and I have two hands to pluck the skin up and then plunge the needle in. So where, if I was doing brushing, I could use one hand to do a nose target or a chin target, and I could brush with the other arm. So it may come down to you need two hands, or you need the dog in a certain position so that you can do this procedure. And that may need to be a trained and then cued behavior that you decide to use. I like using offered behaviors as much as I can because the dog is doing it of their own accord, essentially. So if I observe my learner and I observe that they're more comfortable in a down, or they're more comfortable in lateral or sitting or standing, and they offer that, then I can put kind of our ABCs in place. So if you offer that behavior that you do naturally, and then I come in with my behavior, and then a good thing happens, we can make that the procedure. So you sit, I touch your feet, you get a good treat. You sit, I Dremel one nail, you get a good treat. And it can be consistent and it can always look like that. And then if that dog isn't offering me that behavior, I know he really doesn't want in. Versus a trained and then cued behavior, we may not have worked on it so much with cooperative care, like chin rest, we do a lot in other ways. So then to add an injection to that, I had to go pretty slow. I had to break that down. So he knew what was going to happen. It wasn't going to be a chin rest and then go get your ball. It was going to be a chin rest and then I'm going to poke you and then we're going to get a ball or something good.
Yeah. Now, before I'm going to have you guys kind of end on a big tip or takeaway for those that are just starting their cooperative training journey. But before we get into that, can you guys go into a little bit more about what people can expect from your presentation at Puppy Summit and who it will be helpful for? We'll start with you, Nina.
So I think my big tip is also part of the explanation of what we're going to do in our presentation.
Awesome.
And my big tip is splitting. That's really what cooperative care is. It's taking a big behavior and splitting it down and being able to go back and split again. When I Dremel one of my dog's nails, we always start with a split behavior. I just move very quickly. So I go back and like I'm teaching her all over again, because that is actually the fastest way to get it done. If I try to rush it and go right to the Dremel of the foot, then she will start backing out. But if I just show the Dremel, treat, touch the foot, treat, just go through that like really quick, hey, this is what we're doing, then she's like, oh, I'm all in. It like allows her to warm up.
Yeah.
And that's just a quirk of hers. So knowing how like, our talk is going to help you with the application side of things. So we'll pick some behaviors and split them down and show you what those splits could look like and when you need to think about splitting further. And being able to read the body language and make that decision. And then we'll have video and basically like show you the application side of how all of this is done.
That's huge. I think that in particular for our cooperative care stuff, a lot of it comes down to the stress level of the dog, how comfortable the dog is. So being able to read the body language of that dog and determine this is too much, I need to break this down into a smaller piece. I mean, that's even a training concept that will transcend into any other kind of training that you want to do with your dog. So they will be walking away not just with tools for cooperative care, but training tools.
Yep, exactly.
So Charissa, anything else you want to add about the presentation and what people can expect, and then your big tip or takeaway for those who are getting started?
Yeah, I think we're going to go into kind of our 4 top things that we think about when we think about cooperative care. So we've kind of talked about them, but distractions, training new behaviors, when just kind of low stress handling is the best option. And I think my tip and takeaway is good communication. It's harder when our species doesn't speak the same language that we're working with, but one of my anecdotes is when my niece was little, she needed eye drops, and my sister said, we hold her down, we put her arms like this, and then we drop the drops in. And I was like, I can't do that. Like, she's squirmy. And so I kind of broke it down into these little achievable steps. She watched a screen above her head. I told her that the eye drop was coming. We would do practice. We'd kind of sandwich it between practice, it happens, and then another practice. And afterwards, she got a sticker towards, her whatever her parents would do. But just kind of breaking it down and talking her through all of that. She was like 3 maybe, but she totally understood it. So we can do the same thing with our dogs. It takes a little bit more practice or coaching to watch that behavior and be able to create a 2-way communication with that species. But I think it's so important, and how we can be so clear with them.
Yeah, it is important. It will impact our relationship with them, and it impacts their stress level and how much stress they have to deal with. And, these are things that sometimes for dogs are done daily, sometimes multiple times a day. One of my dogs gets medication twice a day, and it doesn't taste great, but he learned that to take it as a treat and to swallow it. That's a trick for him. And so now I don't have to hide it every single time or, trick him or just pill him. It can become something that he looks forward to, take stress off the dog, take stress off me. And it's so important. There are so many ways that you guys can all add this into your routine. And the best part is, if you guys watch them live at Puppy Summit, you'll also get a Q&A time. So you guys will have some time afterwards to ask questions about what you saw, to be able to ask questions about applications to your own dogs. So even if your dog isn't a puppy, it'll be something that you guys will be able to take a lot away from. I've included a link for you all to Puppy Summit. So if you haven't yet gotten your tickets, you can. It is this weekend. And we've been talking about the presentations live, but you do get access for a year. So if you're unable to watch them right away, you can always get your ticket, tune into what you can, and get caught up later. So I hope that helps everybody with their cooperative care. Nina and Charissa, thank you so much for taking some time and hanging out today. I appreciate it.
Absolutely. Thank you for
Thanks,
having
Chelsea.
me.